Today I'm going to be doing a breast assessment. The first thing you want to do is ask the patient if there's been any changes since the last assessment or any concerns they may have. First, you're going to observe the breasts, and I can see they're symmetrical, pink in color. I don't notice any lesions. They look even and round. Then you want to lift the breasts and check the areola and the nipples. And they also look even, pink in color. The nipples are everted. Then you're going to ask the patient to change their positions. You're going to have them put their hands behind their head with their elbows bent a little bit. Then put their hands on their hips and their shoulders in. And then leaning over and make sure the breast moves symmetrically that way. Then you're going to do a chest wall sweep. You're going to sweep your hand downward toward the nipple on both sides. Make sure you cover the whole area of the breast. And I don't notice any lumps or masses. Then you're going to do bimanual palpation, which you'll hold the breast with one hand and use the other hand to walk the fingers across the breast. And you'll do that on both sides. I don't notice any lumps or masses that way. Then you're going to check the axilla lymph nodes, and you're going to have them lift their arm up, and then you're going to palpate. And you're going to go all the way down to the bra line and then all the way to the elbow. Then lift the other arm and do the same thing on the other side. Then you're going to check the other lymph nodes, and you're going to palpate above the clavicle with your fingertips and then underneath using a circular motion. And I don't feel any palpable lymph nodes when I do this, which is what you want. Okay, now you would have the patient lay down and raise one arm and put a towel under their shoulder. And there's a few different techniques you can do for the breast examination. You can do the concentric circle, where you would start on the outside and palpate in circles around to the middle. Make sure you cover the whole area of the breast and feel for any lumps or masses. The other one you can do is the vertical strip, where you take your fingers and you go in an up and down motion across the whole surface of the breast. And then you can do the wedge pattern, where you start in the middle and work your way out. And you would use the pads of your fingers to do this. And make sure you get the entire surface of the breast. Next, you would take 2 fingers and push the nipple into the areolar wall. And I don't feel any lumps or masses on that side. Then you would have them lift the other arm and the other shoulder, and then you would do the same thing again on this side. And the last thing you should do is teach the patient about doing self-breast exams. You can teach them the techniques that you use on them whichever one they feel most comfortable, and you can have them return a demonstration to you before they leave. Thank you.